Yep, this is a final pitch today, so I hope you enjoy my presentation to the end. So my name is Nobu, the CEO and co-founder of the Feliqs. I'm from Fukuoka, Japan. So we are seeking 12 million funding and also the strategic company to collaborate with to protect most vulnerable human lives. So who they are. So we are targeting extremely premature neonates who are born less than 1,000 grams. Like this baby, they're very tiny. So after they born, so they suffer from the retinopathy prematurity called ROP. This is the leading cause of the pediatric blindness. So it results in the retinal detachment, the high myopia, and visual hemorrhage, so many comorbidity they face. So we target these neonates in a total in 17,000 babies in the US. So this is the biology of the ROP. So after the premature the preterm birth, so they face the oxygen insult after the high oxygen concentration. So it may cause the abnormal neovascularization. So current standard of care is the symptomatic therapy. So it's anti-VEGF and the laser, but they some limitations, the loss of the visual fields, and also recently that when they grow up, they have a very serious abnormality after they grow up. So for example, 30 years, 40 years. So that's why the necessity to prevent this ROP at much earlier stage is emphasized. So that's why we are using our FLQ101 to intervene lipid peroxidation to prevent this ROP. So this FLQ101 is found through our proprietary discovery platform. This is a patent granted in Japan and the US. So this is a drug repurposed small molecule. It shows very nice efficacy in vitro and in vivo. So we had nice data from the ROP animal model. It's oxygen-induced retinopathy, and it promotes the physiological vascularization. So we hope that our therapy it make a future without intravitreous injection. So we talked with the US FDA last week, and it went very nice, and it was very nice pre-IND meeting. So we can see the next our pipeline. So it's AMD. AMD is age-related macular degeneration. So it is a leading cause of the blindness in the US. So there are two forms. The one form is wet AMD or neovascular AMD. So current standard of care is anti-VEGF, like ROP. So this is a very nice market. It's more than 10 billion US dollar worldwide. So the other one is dry AMD or geographic atrophy. The current target is a complement factor. So this year, in the February, the Apellis obtained the first regulatory approval from the FDA. And the Iberic Bio will come next. Then the Astellas acquired the Iberic at 5.9 billion US dollars. So that's why many companies are watching this market now. So we focus on the ion-related cell death called ferroptosis, and our compound, FLQ104. So this is our novel new chemical entity. And we also filed the patents, and we want to intervene in the intermediate AMD to prevent the late-stage AMD, like wet AMD or dry AMD. So I can show some the in vivo POC data today. So we used light irradiation animal model. So our compound protected the photoreceptor cell damage by dose-dependent manner through the oral administration. And also, it prevents lipid peroxidation and prevents the activation of the complement factor in the following stream. So here, I show some the use of proceeds. So last year, we raised 2.5 million US dollar in Japan and for the IND. So as I mentioned, last week we finished our successful pre-IND meeting with US FDA. And next, we prepare for the CMC, preparation, formulation, and GMP manufacturing for the IND submission. So next or now, so I'm raising $12 million for the upcoming clinical trial in the US for the phase 1/2. So we are seeking the money from the Japanese or global VCs now. So we expected to have our phase 2 data in 2025. And this is a very inflection point. And we want to have collaboration with pharma company or the exit. So this is a team. So I have a multinational, multifunctional experience in the Japanese pharma companies. And Dr. Yamada is very nice, a great oxidized lipid biologist. So we welcomed Samir last December to promote our clinical development program in the US. So here's advisors. We have very well-balanced advisors from the discovery to the clinicals. So especially through the discussion with the FDA, so Darius, he's a professor of the Stanford Universities, and Bob and Norman. So Norman did a clinical trial of the prevention of the ROP in Shire. So they did a very nice discussion with the FDA, the division director of the ophthalmology, Wiley Chambers. So we also have very nice regulatory consultants, Mark, and also very nice IP attorney, Minamino-san, maybe here, I don't know. So that's my whole presentation, and we are seeking money and also collaborating companies. And also we are seeking another scientist and clinical trial managers. So please join us. Thank you.
Thank you very much.